Ghana has been one of the countries to receive the COVID-19 vaccine. And there has been a lot of misconceptions about the vaccination. Today we are here for a vaccination rollout concerning the COVID-19.
As you might have heard from the Minister of Information, the vaccines for COVID-19 has arrived in the country. And as part of the strategy, Kumasi, the big Kumasi, will start their vaccination on the 2nd of March. And for that reason, we've met here this morning to solicit your support so that you can help us in the immunization. We all know the information that is going around about the vaccine. There has been a lot of fake news, a lot of half-truth, a lot of myth and misconceptions about the COVID vaccine. But one thing I want to assure you is that vaccination is not new in Ghana. Through vaccination, we were able to eradicate so many diseases. If you remember, recently you talk about measles, and the measles incident has gone down. We did it through vaccination. We've also vaccinated so many people using the yellow fever vaccine. And those of you in Kumasi will remember recently when we had an outbreak of H1N1 in Kumasi Academy. We vaccinated the students. The process is the same. The way vaccines are manufactured, the way they act, and other things is the same. In Ghana, we've embarked on an expanded program on immunization, and we've done this since 1978. And this is the work of Ghana Health Service. So as far as vaccination or immunization is concerned in this country, there's nothing new. As I'm talking to you, we have 12 vaccines that we are immunizing children with as part of the EPI program. We immunize children with a TB vaccine, pertussis, diphtheria, hepatitis B, rota vaccine, measles, yellow fever. When we put together, we have about 12 vaccines that we are already given in this country as part of our expanded program of immunization. And it's Ghana Health Service that is doing that. So vaccination is not new at all. We are going to use the same process as we do in our EPI program and in other vaccination programs to carry out the COVID-19 vaccination. The Ministry of Health and Ghana Health Service have the capacity to do that because that is our job and we've been doing it all the time. So I don't think we will have any challenge as far as the immunization is concerned. The only challenge we will have is for average Ghanaian to buy into the immunization program so that all the target group can be vaccinated so as to protect Ghanaians and then to protect our communities from COVID and its attendant problems. You know the challenges we've gone through over the years, the economic hardships, the lockdowns. It's the whole global world that is going through these challenges. So now if the good God has opened up a way for us so as to use the vaccine to address some of the challenges, then it's left to all of us to buy in. And this is the area that we will need the support of the media because you carry the message. So if you carry the right message, people will buy into it and accept it. So as part of the program, we will start our media sensitization from today. It's expected that people will talk about the vaccine, the way we are going to deliver it, the safety, the efficacy, and then the roadmap that we've drawn as far as COVID-19 vaccination is concerned, so as to support us. So as part of the roadmap, we will do it in Kumasi, the big Kumasi. We call it Greater Kumasi. Greater Kumasi comprises of 14 districts. It includes the metro itself, the municipals, and also some of the districts that surround the Kumasi metro. That's what we call Kumasi metro. And these were the districts that went into the lockdown, if you remember. So that is where we are going to start with. Our target group include all health workers. We will start with the frontline health workers, and I believe you know the importance of it. They are supposed to see to our health needs. And then from there, we will move to all persons with chronic diseases, especially diabetes, hypertension, chronic obstructive airway diseases, chronic kidney failures, the cancers, and other immunosuppressive conditions. We will also focus on our security agencies and then look at the executives. And then, last but not the least, persons over 60 years. So, the rest will follow, as we said, students will be given, teachers will be given, media team will be given, but it's all part of the roadmap that we've drawn. So, for the meantime, we will continue with the first phase and then focus on these 4 groups. So, I'll mention the 4 groups again. The frontline health workers, all persons with chronic diseases that will compromise their health already. When they get COVID, they get what we call comorbidities that's associated with it. Security agencies, persons aged 60 and above, and then the executives. So these are the 4 groups that we will target. And then it will be done in 14 districts, which comprises the Kumasi metro. As part of the roadmap, we will continue with the media sensitization and the social mobilization from now till the 2nd of March that we will start with the vaccination. Every person who will be vaccinated will have a database. So we will need either your national ID, one of your national IDs. It can be the recent voter's ID card, or the national ID, or the passport. So we can capture the number and then use it as part of a unique ID that will be for you. And your name will go into our database so that in the near future, when you need a certificate or any other thing, maybe you want to travel and they'll request your status, we can generate any information from that database. So basically, that's what we are going to do. One thing I want to assure all of us is that the vaccine is safe. As we said, what is coming is the one that is manufactured by the AstraZeneca. That's the one that we are going to use. The other one, the Sputnik, which is a Russian base, will also come as emergency. But if you get the first dose for the AstraZeneca, you also get the second dose for the same vaccine. The reason is that though vaccines have the same purpose, but the manufacturers are quite different, and each of the processes are quite different. So when you start with the first dose for one vaccine, it's better to have the second dose for the same one, so that at least the safety and the efficacy and other things and other issues will be addressed. It's better that way. So that is the process that we will follow. We are going to take all the health workers through training, very intensive training, for them to understand the vaccine. We call it AEFI, Adverse Event Following Immunization, which happens in all immunization processes. We will take them through the mode of delivery, and then how it should be stored, the cold chain systems and other things. All this will be done during the training. And I believe that they already have the capacity, but we will need to build on, because we want to make sure that the vaccine is very safe, and that as far as the vaccination is concerned, everyone will take it with minimal side effects. So all our health workers will go through training. And there will also be a social mobilization activities. So the media will take it, the other community members, there will be a lot of partnership in this process. Especially, we will want the opinion leaders to lead the process, so that at least if they are vaccinated, it will also ensure that people will accept the vaccine. So that's the reason why we are calling on the executives and all the opinion leaders to come in. We will vaccinate them first. Maybe the media will take it up for them to know that at least everybody can be vaccinated and there's no problem associated with it. That is what we will do. The reason why we've called you, I believe that you will take the message along, and then if you have any issues, any questions relating to the vaccine, I know the Minister of Information has given you a lot of information already, but if there are any specific ones that you want us to talk about, we will use the opportunity to address it. Thank you. As I say, a friend, Anopa Muinaba. Anopa Yenshia Munu. Obronive Kasa, your friend, media sensitization. I'm saying, I have to say, Radia Daroma, your first consignment of COVID-19 vaccine, no, abedu omayimu anopai, say muina moteye. Na, said the answer no. Baby, I ran a accident then, no, a honor, a beshassi, a fee. It is a mobile kaya, Yarani Shassi, and a Shassia wong trying a friend Greater Accra, and a Bel Kumasi, Greater Kumasi, and a part of Central Region, Mr. Kaswa. Enti baby, a year lockdown, no. A honso na, ye day vaccination, no, a Shassi. Enti Kumasi Hano, baby, a year lockdown, biano, ye beshassi ho. Ye Kanya, a 14 districts. In the Ashanti Region, you have 43 districts. 14 of the districts, no, they fall within what we call the Greater Kumasi districts. Into a whole any vaccination, no, ebe shasi. And there, the no hey, your friend media sensitization, your person will be boy and said the the information no ebe call. Now, said the and she share no etia ewo honey. Near the kind no. About now she share say. Any part teacher will be and a baby kind of vaccine a momo. Enti obroni friend frontline health workers, private and public. Omo we are hospitals near year, omne area ni epion pa no omne do mbeshase. Afi if you are omo wo area to say diabetes, hypertension, a betimi aku omo ntem no. Omo so ye be ma omo. Na ya ma ye mpanyimfo. Omo no omo hwo man so my your friend executives. If you are, ye bema obi a wadi emfie aduesia eko empanimfo na ye security agencies no ye de bema omo enti omo ne so far no omo na ye fra omo target group a ye de omo under the first phase. Second phase no media for kan ho, teacher for kan ho, school for kan ho. Say Minister for Information Ede Amade Dow. Enti no efi ne ye share media sensitization na se abohu daru. Ye daru bo ni say da your friend 2nd of March. Say President ebe yi. Ebe bia no amayen. Amaya hyase ede vaccine no ama se nipa ya yabobo mu din. Vaccine na ba bedu o man mu. Na de o mu ni say Ghana Health Service and a day ma. Yatete and sembebre ankrofo ka e social media efa vaccine no ho. No kwara woman say enye we ni vaccine na Ghana edi kan a ye di be adwuma. Ye hwe de obroni friend expanded program on immunization na. Ye wo vaccines be say 12 dumienu a yɛde ma nkwara ɛne apemfo ɛwɔ man yi mu a yɛyɛ ho adwuma enti anya de foforo kra na yɛbɛyɛ enti kwan a yɛnam so a yɛde ma vaccine no saa pɛpɛɛpɛ enti de yɛbɛtumi ahyɛ mo bɔ ne sɛ vaccine nya de foforo a yɛbɛyɛ aman foforo biara yɛ bi yɛn so yɛbɛto aso enti yɛn nyinaa yɛmfa komapa ɛne vaccine no ɛbɛboa yɛn am ne sɛ mo bɛbɔ dawura ma yɛn sɛ de ɛbɛyɛ yɛn nyinaa yɛbɛsom na yɛagye vaccine ɛno ɛna ɛbɛboa yɛn sɛ de ɛbɛyɛ yɛbɛtumi akɔnti ayare no mo nyinaa bɛhu sɛ yɛabrɛ yɛn nnwuma asɛe ɛnɛma bebree ha yɛn enti yɛn mmɔden na yɛn som na vaccine na ba sɛ de aba na bɔ mmɔden de aba no yɛn so yɛn som na yɛn bɔ ho dawuro yɛbɛyɛ training ama health workers ni nyinaa yɛhyɛ ase afi adwoɔda obiara ɔde vaccination bɛmbɔ biara yɛbɛ training ne sɛdeɛ ɛbɛyɛ obɛtumi ama no kwan pa so na ankɔnkɔfa ɔhaw biara ma enti yɛafrɛ district directors ni nyinaa yɛma ɔmo training sɛdeɛ ɛbɛyɛ a ɔmbɛtumi de vaccine na ma kwan papa so enti bɛma obiara mo hu ɛna ɛkwan a yɛbɛfa so a yɛbɛ obroni frɛ no cold chain yɛbɛ store vaccine no sɛdeɛ ɛbɛyɛ a vaccine no bɛyɛ papa na ɛnsɛe ɛno nso yɛbɛ training wɔn wɔ ho yɛbɛ training wɔn wɔ sɛ ubebe yɛfrɛ no adverse event following immunization sɛ bi ɔhaw bi ba wɔ bere a wɔwɔ vaccine na ɛkwan a wɔbɛfa so nso yɛbɛ training nipa no ama ne nyinaa ɛyade a yɛbɛyɛ obroni frɛ biribi surveillance yɛde yɛaso bɛto fam ahwɛ sɛ bi obi ɔbɛwɔ obi no ɔwɔ haw bi a ne nyinaa yɛade a yɛbɛyɛ sɛdeɛ ɛbɛyɛ a yɛbɛhu sɛ obi a ɔwɔ paneɛ no bibiara no yɛde ani bɛdi n'akyi enti obroni frɛ biribi database obi a ɛbɛwɔ paneɛ no biara no yɛbɛgye wo data nyinaa ne asan agye wo unique ID either wo passport anaasɛ wo national ID anaa wo voters ID ɛno ne yɛde bɛtrake wo ahwɛ baabi awɔ sɛdeɛ ɛbɛyɛ adaakye yɛbɛhumi ahu ɔkwan a yɛbɛfa so aboa wo ɛnɛhwɛ it's okay yɛnyɛ yi kakra enti yɛkɔ so no deɛ yɛbɛsrɛ ne sɛ yɛntumi ɛma mo da sɛ bi a ɛda wei yɛbɛwie da bia a yɛbɛwie biara no ne vaccine dodoɔ a bɛba biara no yɛde bɛma aban na hyɛ yɛbɔ sɛ ɔbɛma yɛn vaccine 2 million doses ɛwɔ ha 2 million doses enti yɛde bɛma kɔsi sɛ obiara ehia sɛ obɛnya bi no obɛnya bi ansa na yɛbɛka sɛ yɛwie adwuma no enti ɛnyɛ nnɛ a naasɛ ɔkyena adwuma ɛsɛ yɛyɛ ne nnɛ no ɔkyena yɛbɛyɛ kɔsi time a vaccine na aban no de ahyɛ yɛbɔ no which is 20 million doses no yɛbɛnya ne nyinaa na yɛ roll out ne nyinaa ma obiara president kaa sɛ sɛ onya bi no wanya bi ansa na yɛde adwuma no bɛyɛ dɛn ɛbɛkɔ awieyɛ enti ɛnyɛ sɛ bi a dakoro ɛne yɛde bɛma ne awie enti sɛ deɛ yɛ nyinaa yɛteeɛ no ɛyɛ 20 million what doses ɛne yɛ expect ɛsɛ yɛde bɛma Ghanaians. Freeport Boateng Medical Center was to cater for mild, moderate. Kumasi South Hospital, mild, moderate, and severe. And Akofanochi was to cater for mild, moderate, so severe and what? Critically ill patients. Yakasi critically ill na obia or ventilator so. Obi or ventilator so. Now, as I do obi better ventilator so no, and you may be brain here, say. Obeye nurses for uhiam you're from critical care nurses doctor uhian and you're from doctor anesthetist na uhwe Ashanti mantam mu ha na kofa no chenko na ense omowo enti se obi yare a you're from critically ill na ubehu se okokofa no che a omowo ventilators ana omo prepared ya mayen ventilators na 5 at any point in time, no, any 5 per any bit we are managing as critically what? Ill patients on ventilator. And no na a year issue na mo ka ho asem no. Say critically ill for no doors be brea. Doctors say here am, nurses say here am, critical care nurses say here am no. That means you say any beba or critically ill, but on that ventilator no so your day. And now if you say ventilator no, and your COVID for one guso. And my omo was so omo how guso. Obi a when your stroke da so. I for be brain so your day. Da so. And until now, you say ABA, you need beds, and I say you want to. Now you have enough beds to cater for mild, moderate, and even some of the severe, those who need oxygen. But when it comes to critically ill patients that we need to put on ventilator, that is when we have the challenge. Ventilator, no cough from poor body, your ventilators fall, crying is zero. Now, so we need critical care nurses. We need doctor anesthetists. To say doctor anesthetist no critical care nurse or no take of a notch, you're the same person, no necessary, or call from poor boating. Now, to the moment I would do any panel bed 2 ventilators, no. As I would run who 24 hours. Critical care nurses should be on duty for 24 hours, nurse anesthetist on 24 hours. And now a idea, and yes, and your man in the one, yes, baby, omunyana. Nemo muno. The category of people we need so they can critically care for the critically ill person is not there. Because and yes, baby, and I be nyom. So no work on financial how we are doing. Almost share in the panel. And now those only on ventilator now we were talking about. Because as at now we have 155 beds available, and we have only 61 on admission. That means that we still have enough beds for people who will come sick. But when it comes to those we need to put on ventilator, then our number of ventilators are few, and not even the ventilators, but the human resource to cater for them are very few. That is what happened.
Dr. Emmanuel Tenkorang stated that the vaccination will start on the 2nd of March 2021, and they've targeted for 4 groups who will start with the vaccination. That will be the frontline health workers, the aged, the executives, and the security agencies.